Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Which of the following is not a clinical feature of post-traumatic stress disorder? Um, Post-traumatic stress disorder, you will see flashbacks, you will see hyperarousal, and emotional numbings are seen. Hallucinations are not seen. Next.
in post-traumatic stress disorders, the patient will have flashbacks about the event. The patient avoids going to that place which is associated with the event. The patient can have hyperarousal, emotional numbing. So these are main features of post-traumatic stress disorder. Hallucinations are seen in schizophrenia. Hallucinations can be seen in drug intoxication, especially cocaine or LSD intoxication. You can see hallucination, and hallucinations can also be seen in delirium tremens, which is due to alcohol withdrawal, can also present with hallucinations. Thank you, and thank you for watching.